Together we achieve victory over heart failure.
Hello, I am Dr. Sushan Mukhopadhyay, the Director Cardiac Surgeon at Apollo Multi-Speciality Hospital, Kolkata. Nowadays, we often see young people coming to us with symptoms of heart failure. We will discuss something about what is heart failure. The term heart failure sends fear in our mind, and we think that probably the heart has stopped working. However, it is not so. The condition is a common condition happening in Indian population, especially in the young, but the practical problem is that the heart is not efficient enough to pump the amount of blood that is received in the heart into the peripheral system as efficiently as it is needed. That is why the patient often gets some symptoms. Surprisingly, in India, the population that is afflicted with heart failure is young population, which is different from Western population, where the population is elderly group. This is a unique phenomenon or a unique finding in our country, and the reason could be attributed to genetic factors, of which these are compounded by certain medical conditions. Obviously, Indians are more affected by diabetes, obesity, and metabolic problems, as well as smoking and lack of exercise. So these things exacerbate the symptoms of heart failure. Now, if we look at what are the symptoms, how do you say that the patient is having heart failure? Often the symptoms come as fatigue, confusion, palpitation, and in advanced stages, breathlessness, tightness in the chest, unable to do work, cramps in the legs. All these are symptoms that can suggest to us that the patient may not be receiving the amount of blood that is being pumped as efficiently that is pumped by the heart. Now, are there any measures that can be taken to treat or circumvent these problems? Yes, the first thing is lifestyle management. By lifestyle management, what we need to say is to take care of your own self. That is when supposedly you reach 40 or 45 years of age and you have a family disease affected of a genetic predisposition, you should take care of. So do a screening test, do the blood tests, do the lipid parameters, do LFT, do the hemoglobin. The hemoglobin should be good, the creatinine should be all right. And apart from that, if you are symptomatic, NT-proBNP, a test, can give you an idea whether this is really a heart failure symptom or not. Number two, you need to maintain a good diet, maintain your healthy weight, you maintain some physical activities to keep yourself healthy, and an echo and ECG screening to tell that you are okay. Now, supposedly, if you are having symptoms, if a diagnosis has been made for heart failure, there is no way out? Of course, there are various methods to treat heart failure, of which 80 to 90% cases, a medical therapy, a good guideline-directed medical therapy is the cornerstone of treatment. And we have multitude of medications available, with very new medications also, wonder drugs that treat heart failure. There has been a revolution in this scenario, and we get newer drugs which can help us treat heart failure when patient is diabetic or not, whether the patient is obese, hypertensive, and all that. And if there is a more advanced problems of heart failure, there are therapies that are available, such as CRT, angioplasty, cardiac surgery, valve repairs, valve replacement, TAVI, and at the end, we also have a very efficient treatment, the left ventricular assist device or heart transplant, which has a very good result in expert hands in our country. Thus, we say that you should not be scared to hear the term heart failure. It is a disease, it's a range of disease which can start very early and can be managed with lifestyle and medications very effectively in 95% of cases. Very rarely do we require surgical management or device management. Thus, stay well, stay healthy. Thank you very much.